Can Saline implants rupture? What you need to know. Imagine going in for a breast augmentation and wondering what happens years down the line if something goes wrong. Well, Saline breast implants can indeed rupture, and understanding what that means is important. A rupture occurs when the outer shell of the implant develops a tear or hole, causing the Saline solution inside to leak out. This is a known possibility with Saline implants and is part of their typical lifespan. Research shows that the chance of rupture or deflation for Saline implants is about 3 to 5% within the first 3 years after surgery. By 10 years, this risk increases to around 7 to 10%. Some studies suggest that by 15 years, rupture rates could reach 10 to 14%. On average, most ruptures happen around 5 to 6 years after the implant is placed, meaning many women might need a replacement or removal during their lifetime. When a Saline implant ruptures, the Saline solution leaks out and is safely absorbed by the body. This causes the breast to deflate visibly and fairly quickly, often within days. Because of this, rupture is usually easy to detect without needing imaging tests. The most common causes of rupture include aging of the implant, trauma like accidents or needle punctures during biopsies, or damage during surgery. Sometimes surgical instruments can accidentally damage the implant shell, especially if the implant is handled roughly. Health-wise, a ruptured Saline implant generally poses minimal risk because the Saline solution is harmlessly absorbed by the body. Still, a rupture means the implant needs to be surgically removed or replaced to restore the breast's shape and prevent other issues. Regular follow-up with a plastic surgeon is recommended to monitor implant health. Imaging tests like ultrasound or MRI can be used, especially for silicone implants, but Saline implant ruptures are usually obvious because of the quick deflation. It's also worth noting that rupture rates can vary depending on the implant's design, manufacturer, and individual factors. Smooth shell Saline implants might have a slightly higher chance of rupture, but this difference isn't very significant. Capsular contracture, which is scar tissue tightening around the implant, is a separate issue and isn't directly linked to rupture. In summary, Saline breast implants can rupture over time, and when they do, the deflation makes it easy to notice. While rupture is a common reason for needing implant replacement, it doesn't usually cause serious health problems. Regular checkups and discussions with a qualified plastic surgeon are key to keeping your implant safe and knowing when intervention might be needed. Always consult with a healthcare professional for personalized advice and to understand your options.